Mr. Chairman, members of the committee, thank you for the opportunity to provide testimony today. Rhode Island Kids Count would like to voice the strong support for Senate Bill 2124, and before I go any further, I should introduce myself. My name is Katie Arona, and I'm the Health Policy Analyst for Rhode Island Kids Count. I would also like to thank Senator Ana Quesada for her leadership in sponsoring this bill, and also thank the co-sponsors, some of which are here with us today, including Senators Metz, Valverde, Goodwin, and Nesselbush. Our support for this legislation really reiterates our organization's strong commitment to address the needs of children and family in Rhode Island, with a particular focus on closing immigration and ethnic disparities. Worldwide, rates of maternal mortality have steadily decreased over time in nearly every developed country. However, despite this, rates of maternal mortality in the United States are on the rise and disproportionately impact already vulnerable populations. Evidence clearly demonstrates that women of color are less likely to have adequate access to maternal health care services and are more likely to die in pregnancy and childbirth than their white counterparts. Black women are 3 to 4 times more likely than white women to die in pregnancy or pregnancy-related complications. These racial disparities in maternal mortality span all levels of education, age, and income. In our state, the maternal mortality rate between 2013 and 17 was 11.2 per 100,000 births. This statistic masks significant racial and ethnic disparities. Within that same time period, Black women in the state were nearly twice as likely as white women to receive delayed prenatal care, and Black women in our state were 42% more likely to experience a severe complication at delivery than white women. Unfortunately, this impacts children as well. The infant mortality rates are associated with maternal health, quality of and access to medical care, and other socioeconomic conditions. While infant mortality has declined nationally, stark disparities still remain. In Rhode Island between 2013 and 2017, the Black infant mortality rate was 11.5 per 1,000 births. Simply put, Black infants in Rhode Island die in the first year of life at a rate nearly 3 times that of white infants. The Black infant mortality rate is the highest of any other racial or ethnic group in the state, even after we control for known risk factors such as socioeconomic status and parental educational attainment. A growing body of evidence indicates that pervasive racial bias against Black women and unequal treatment of Black women in the healthcare system results in inadequate treatment for pain. This, coupled with stress from racism and racial discrimination experienced throughout a woman's lifetime, contributes to the unacceptable health outcomes among Black women and their infants in Rhode Island. Ultimately, improving access to doula services is a key strategy to address the unacceptable racial and ethnic disparities that exist as it relates to maternal and infant morbidity and mortality. We ask you to support this bill that would increase access to doula services in our state and would take a crucial step forward in addressing health equity in communities of color. I would also like to note, Mr. Chairman, that this bill is a policy priority of the Right from the Start campaign. It's a newly established early childhood effort that's led by Rhode Island Kids Count and 5 other organizations, including Beautiful Beginnings, Economic Progress Institute, the Latino Policy Institute, Rhode Island Association for Infant Mental Health, and Rhode Island Association for the Education of Young Children. So here's a handout for the campaign. And you mentioned your commission to study the impact of, I always forget the name of it, insurance rates. Yes. But I do go to all of the meetings, and if you did want to have a presentation on doulas from a data perspective and a policy perspective, I would be happy to share any information and help you with that. Any questions?
Any questions?